More than 932,000 people have died in the U.S. since 1999 from a drug overdose. Nearly 75% of drug overdose deaths in 2020 involved an opioid. The opioid crisis has been devastating the U.S. for over 2 decades. Opioid addiction, overdoses, and deaths have been on the rise, affecting communities of all socioeconomic backgrounds. According to the Centers for Disease Control and Prevention (CDC), opioid overdose deaths increased by 30% from 2019 to 2020, reaching a record high of over 93,000 deaths. In this video, we will take a critical look at the reasons behind the opioid crisis in the U.S. and explore the factors that have contributed to this epidemic. First, it is important to understand what opioids are and how they work. Opioids are a class of drugs that include prescription pain relievers, such as oxycodone and hydrocodone, as well as illegal drugs, such as heroin and fentanyl. Opioids work by attaching to specific receptors in the brain, spinal cord, and other parts of the body, reducing the perception of pain and producing feelings of euphoria. However, opioids are highly addictive, and over time, the body may develop a tolerance to the drug, requiring higher doses to achieve the same effect. One of the main reasons behind the opioid crisis in the U.S. is the overprescribing of opioid painkillers. In the 1990s, pharmaceutical companies began aggressively marketing prescription opioids as safe and effective pain relief, leading to a surge in prescriptions. According to the CDC, the amount of opioids prescribed in the U.S. quadrupled from 1999 to 2010, despite no increase in the reported level of pain. This overprescribing led to a surplus of prescription opioids, which were often diverted to the illegal market, where they were sold and abused. The opioid crisis in the U.S. is not limited to any particular age group or demographic. It affects people of all ages, races, and genders, with an increasing number of cases reported among young adults and adolescents. According to the National Institute on Drug Abuse, the number of opioid-related overdose deaths among young adults aged 25 to 34 increased by 35% from 2019 to 2020. Furthermore, the opioid epidemic has also had a significant impact on pregnant women and their babies, with a rise in neonatal abstinence syndrome, a condition in which newborns experience withdrawal symptoms after exposure to opioids in the womb. The opioid crisis has also had economic consequences, including the cost of healthcare, lost productivity, and increased crime rates. According to a study by the Council of Economic Advisors, the opioid epidemic cost the U.S. economy over $696 billion in 2018 alone. This includes costs related to health care, criminal justice, and lost productivity due to addiction and premature death. The economic impact of the opioid epidemic has been felt across the country, with many communities struggling to cope with the financial burden of addiction and overdose. Government policies and regulations have played an essential role in contributing to the opioid crisis. In 2016, an investigation by the Senate Committee on Homeland Security and Government Affairs found that the Drug Enforcement Administration failed to use its authority to curb the flow of prescription opioids into the market. The report highlighted instances where DEA officials ignored warnings about suspicious orders and failed to take action against pharmaceutical companies that were overproducing and distributing prescription opioids. Furthermore, there have been instances of corruption and unethical practices within the pharmaceutical industry. In 2007, Purdue Pharma, the manufacturer of OxyContin, pled guilty to charges of misleading the public about the addictive nature of the drug and paid a $634 million settlement. More recently, in 2019, the founder and former CEO of Insys Therapeutics, John Kapoor, was sentenced to 5.5 years in prison for his role in a scheme to bribe doctors to prescribe the company's highly addictive opioid, Subsys. So, the overprescribing of opioids was facilitated by a lack of regulation and oversight in the pharmaceutical industry. Pharmaceutical companies downplayed the risk of addiction and marketed opioids to doctors, who were often incentivized to prescribe these drugs. The lack of regulation allowed for the widespread distribution of opioids, leading to a significant increase in opioid addiction and overdose deaths. Another factor contributing to the opioid crisis in the U.S. is the availability of illegal opioids, such as heroin and fentanyl. As prescription opioid abuse became more widespread, many people who had become addicted to these drugs turned to illegal opioids as a cheaper and more accessible alternative. Heroin, a highly addictive and dangerous drug, is often laced with fentanyl, a synthetic opioid that is 50 to 100 times more potent than morphine. This combination has led to an increase in overdoses, as users may not be aware of the potency of the drug they are consuming. The opioid crisis in the U.S. has also been fueled by social and economic factors. Many people who become addicted to opioids come from communities that have been devastated by poverty, unemployment, and other socio-economic challenges. Lack of access to health care, including mental health and addiction treatment, also contributes to the problem, as many people do not receive the care they need to recover from addiction. Finally, the opioid crisis in the U.S. is a complex issue that has been driven by a combination of factors, including overprescribing of opioid painkillers, lack of regulation in the pharmaceutical industry, availability of illegal opioids, and social and economic factors. Efforts to combat the opioid epidemic have been ongoing for many years, but progress has been slow. In recent years, there has been a shift towards harm reduction strategies, such as expanding access to naloxone, a medication that can reverse an opioid overdose, and increasing access to medication-assisted treatment for addiction. However, there is still much work to be done to address the root causes of the epidemic, including overprescribing of opioids, lack of access to addiction treatment, and the illegal drug trade. By understanding the complexity of the issue and the various factors that contribute to the crisis, we can work towards effective solutions that address the needs of those affected by opioid addiction and overdose. The government's response to the opioid crisis has also been criticized for being inadequate and slow. Despite the surge in opioid-related deaths and overdoses, it took several years for government officials to take significant action. In 2016, Congress passed the Comprehensive Addiction and Recovery Act, which aimed to address the opioid epidemic through various initiatives, including expanding access to treatment and recovery services. However, the implementation of the law has been slow, and many experts argue that more needs to be done to adequately address the crisis. The government's failure to effectively regulate the pharmaceutical industry and to take swift action to address the opioid epidemic has contributed to the ongoing crisis in the U.S. It is crucial that policymakers take a critical look at the factors that have contributed to the crisis and implement evidence-based solutions to prevent further harm and provide support to those affected by addiction and overdose. Thank you for watching this video. We would like to know your opinion or thoughts on this topic. If you like videos of this kind, feel free to like and subscribe.